Good afternoon. Welcome to the Center for Disaster Philanthropy webinar, COVID-19, Managing a Global Response. This is Regine Webster, Vice President at CDP. This webinar is presented with generous support from the UPS Foundation and is co-sponsored by Interaction, National Volunteer Organizations Active in Disasters, the Council on Foundations, the National Center for Family Philanthropy, Grantmakers in Health, Grantmakers in Aging, United Philanthropy Forum, and the Funders Network for Smart Growth and Livable Communities. A few reminders just before we get started. First, this webinar is being recorded. It will be available along with recordings from past webinars on our website and our YouTube channel shortly after the webinar is complete. All registrants will be sent a link to the recording. You all are more than welcome to submit questions at any time using the Q&A box at the bottom of the screen. We'll do our best to get to as many as possible at the end of the panel presentation, and then questions that aren't answered will be answered in a follow-up document that will be available on this webinar's page on our website. And if you're on Twitter, please use hashtag CDP for recovery to share the discussion. I just want to frame the conversation that we're about to have with our three panelists right here. Over the course of the next 59 or so minutes, we're going to cover the following four things. First, why US-based philanthropies and funders should engage in global funding, especially for COVID-19. How to begin international grant making and the resources that are available to support you. Lessons learned and arguably forgotten from the Ebola crisis that we should remember from COVID-19, for the COVID-19 response. And then lastly, the importance of focusing on moving power to local actors. To put some context around where we are, this day in time, we wanted to highlight a few key issues and statistics. Worldwide, there have been more than 9.2 million cases and over 475,000 deaths, and nearly 5 million people have recovered. In the United States, we've had nearly 2.4 million cases, 123,000 deaths, and almost 1 million have recovered. After the United States, the countries with the highest numbers of new cases are Brazil, India, Russia, and Chile. Globally, there's severe undertesting, meaning these numbers are not accurate. And many NGOs have reported to us that people are struggling to access testing around the world. Within the United States, cases are mostly increasing across the South. Hot, humid weather is not putting an end to our cases. And congregate living facilities are a key concern. This includes correction and detention facilities, nursing homes and long-term care facilities, meat processing plants, and migrant housing. Internationally, this also includes informal settlements and refugee camps. And now I'd like to introduce our guests who are going to help us put all of this context into perspective. Natalie Ross is the Vice President for Resource Development and Strategic Opportunities at the Council on Foundations, where she leads revenue generation for the organization. Natalie previously directed the Council's Global Philanthropy Program and worked at the Aga Khan Foundation, leading a global portfolio of programs and partnerships focused on sustaining civil society organizations in East Africa and Central Asia. Pilar Pacheco is the Senior Program Officer of Emergency Response in the Global Development Division at the Bill & Melinda Gates Foundation. She oversees the emergency relief portfolio and co-leads the capacity building work stream that focuses on strengthening the capacity of local actors to lead humanitarian action. Dr. Valerie Bemo is the Deputy Director, Emergency Response, also within the Global Development Division at the Bill & Melinda Gates Foundation, where she developed emergency strategy and implementation worldwide in response to major natural disasters, conflict, earthquakes, the Ebola outbreak, and most recently, the COVID-19 pandemic. She also executed agricultural development in West Africa and holds over 20 years of direct field experience and strategic development in Africa, Asia, and Europe. Welcome and thank you so much for taking the time away from your work to speak with us today. I'm really looking forward to the conversation with you three. All right, Valerie, you're going to kick off our conversation for us. The Bill & Melinda Gates Foundation is a leader in global philanthropy, especially around health equity. can you help us understand why it's important for funders in the United States to support global investment in healthcare and other issues?
Thank you, Regine. I'm happy to be here, and thank you for CDP to invite us in this, to invite me in this webinar. One of many that have been really successful and really interesting to listen. To answer the question is really, I think we don't have choice. I'll start by that. We don't have choice. We live in a global world, and where global collaboration is important, and we know that many of us are in a space where we are talking. We saw the Black Lives Matter. We saw everything, even in the US here, the differences between neighborhoods, between countries, between leadership make a big difference. And for us, if we talk about philanthropy, we have to think about equity. And we cannot be just here and with the richest country and forget that the rest of the world may be suffering, and that is an equity issue. But also, I think because of the interweaving of the world, our success here will also define our failure, or not going to the rest of the world will define the failure, and we cannot succeed if we are not going globally, if we cannot actually look at the other problem. But there's one thing that is actually we don't necessarily think about. It's not about just the giving. It's not about just here in the US going to give there, but it's actually, there's a lot of innovation and there's a lot of learning, because when you are in the less resource setting, you tend to be more innovative and to create some solution. And actually, there's a lot to learn. And the more diverse and the more global we go, the richest our response is coming. And actually, it's really good to be able to see the culture and also understand how do we function in this world, because America lived and have been based on the immigration and based on the world around. And it's not today that we should stop. We can actually intensify that place. Thank you.
A follow-up question to you, Valerie, about the same, a follow-on topic is around globalization. We're well aware that globalization itself presents a challenge in the COVID response. Can you tell us more about
that? That is really, you are right. And I think you alluded a little bit in the previous question about we're in a globalization. Just simple things. How many of us were supposed to travel out of the US the last 3 months? And we are stuck. And it's part of, it can be even for vacation, not even for work, for just vacation, we cannot move. Then unless we look at it as the interconnectiveness, that everything have a link and the consequences. Some of the market will not be open. Some of even our clothes, a lot of them come from outside, will not be able to do that. But also when we look at globalization, we saw the challenge on even just in the US here, getting ventilator, getting all the products that we need is not possible because of a lot of them are done in Asia. And unless we start really looking at how we are connected, it's important. Especially COVID shows that although it started as a health crisis, it's not a health crisis anymore. It's an economic crisis, it's a geopolitical crisis. It's like who is fault, who is moving, who have what, and that is why the globalization, and it's a challenge. How do we get making sure, and we'll come back to that later, because how do we ensure that we have an equity and that everybody have access to the same resources? Just an example. In the same way we saw here in different states, in Africa, some of the countries want to order some testing or want to order some PPE, the protective equipment. And even with the money, they can't get it. Some of the vendors said, oh, your order will deliver it in 3 months. That will be too late. How do we start not looking at it? And it's been a challenge, the supply, the movement. And the big piece is that we have used to have the world, international world, go and helping people and not necessarily build the capacity of people locally. Now nobody can go anywhere. And it's default now to the local organization and the local capacity or local government to take their thing. In a way, it's a challenge, but it becomes an opportunity for us to look at it. Thank you.
In thinking about one of the concerns that we've heard from healthcare professionals is that other diseases will be ignored in light of the focus on COVID-19. What are you hearing about that?
Yes, definitely. We saw how even simple health facilities here were deserted. All the elective surgery, everything. I have one of my friends who is pregnant here in Seattle, and she was like, oh my goodness, what do I do? Do I have to go to the hospital? I hope I don't have any issues. And that is the fear everywhere around the world. But we're already hearing in multiple countries. For example, South Africa, who have one of the biggest cases of HIV in the continent and even TB, we're already seeing that the TB and HIV number of cases are reducing, not because of COVID have been reducing the contamination, but just because people are not going to the hospital, people are not getting tested. We already saw there's a lot of countries where there was a comparison with the number of women delivering in the hospital, the vaccination. It's already, we saw in some places completely decreased because people are scared to go to the health facility. But also some of the health facility staff don't want to because, like we say, when we have a reduced protection equipment, some of the health facility didn't have it. Then the staff like, I'm too scared to be working. Then it's multiple layers of people scared to go, but also a lot of focus have been on the COVID. That means that we start a lot of vaccination campaign have been delayed or canceled or postponed just because it's also a risk to the people going to vaccinate. We saw, for example, we started in Africa, the malaria season is starting with the raining. And this is normally by April, May, this is where the mosquito distribution, the prophylactic and preventative treatment should have been distributed, but a lot of them were not able to be happening because of the lockdown and because of the fear of COVID. That means that we expect to have an increased number of mortality, not due to COVID, but due to other diseases. And we already seen some of this decrease of services, then we anticipate that will be the case. Thank you.
Let's turn back the clock a minute and step back and look at the Ebola crisis, Valerie, in West Africa. You know, Gates was also an important funder then. Can you tell us what what did you learn from Ebola that's important for funders to continue to do now with COVID-19?
Yes, thank you, Regine. I think first, let me step back to say for Ebola, the difference with COVID now is that Ebola was just 3-4 countries affected, and now it's the whole world. That means that the problem we have in Ebola is 3, 4, 5 times or maybe 100 times more complicated than it was with Ebola. But one of the things that really we learn a lot from Ebola and that we see with the COVID is that we have to see the crisis as multiple crises. It's a COVID crisis, yes, the outbreak. You have the health services, like we mentioned earlier, essential health services. We need to make sure that these services are continuing. We need to look at the economic, because a lot of the country are opening the lockdown, even the number of cases are increasing because this is not sustainable. Most of the people are the daily laborers and they cannot sustain without that. The schools are closing. But one of the big pieces that we really learn, and that is essential, the leadership of the country in places where we invest after Ebola or during Ebola to create a system of preparedness, having the public health emergency operation system ready, having system data quality, people trained to know what to do. We saw that they were actually faster in implementing, but also where the community have been engaged, where the messaging have been clear, where people have been interacting and create a sense of trust we saw also that this actually make a big difference in countries who have been liberated. But the supply chain become the big part, and the involvement of all the part of the society, that is not just a Ministry of Health, but the rest of the society, including the private sector. This time we saw the private sector from the beginning just stepping up in a lot of countries, and that making a big difference. And compared to what we learned when we had Ebola, where it came really later in the day. This from the day one, all these part of the community were involved in the crisis. Thank you.
Thanks so much, Valerie. Natalie, we're going to go to you next, but before we do, just a reminder that listeners can put questions in the Q&A box at the bottom of your screen. So if there's anything that Valerie has said or that you hear from Natalie and Pilar that's interesting and you'd like to follow up on, please just tuck it into that chat box, or excuse me, not the chat box, the Q&A box. Natalie, thank you so much for joining us. You know, one of the great things about you is that in addition to being a terrific grant maker and you know, thinker in the space of philanthropy, you also have a really exceptional handle of all of the processes, and I know I've benefited personally from your expertise. So I'm hoping that you can help provide our attendees with some concrete information that will help them with their international grant making. So tell us, what does the flow of grants from U.S. foundations to global partners look like, especially now during COVID?
Great, thanks, Regine. Yes, I'm happy to join and talk a little bit about kind of what we know about global flows of grants from by U.S. foundations in kind of a normal operating time. So we can look at the most recent data, and then during COVID. So the last kind of comprehensive report that we have looked at grant making through 2015. And at that time, global giving by U.S. foundations was on the rise, and we continued to see a year-on-year increase with the highest level ever in 2015. Notably, grant size over the last decade or 2 decades has really increased, so that the average grant size is very large. We've also seen increased international giving by community foundations, and it's great to be on this webinar with colleagues from the Gates Foundation. During the period of 2011 to 2015, the Gates Foundation made up over 50% of total global grants by U.S. foundations. And importantly, as we get into discussions around localization and response to reaching nonprofits in other countries, in average, only about 12% of U.S. grants that support global programs actually go to non-U.S. recipients. And the rest go to different types of, or to local organizations, I should say. The rest go to different types of intermediaries. Some of those intermediaries are not located in the U.S., but they're either going to U.S. nonprofits working overseas or intermediaries. So if we go to the next slide, I looked at the data currently in the database managed by Candid to understand how U.S. foundations giving in response to COVID, where their resources are flowing. So, you know, there's been over $11 billion in grants. Those are from all funders, not just American foundations. And American foundations have done about $7 billion of that in the current Candid database. And so if we look at where regionally these grants are flowing, it's not necessarily surprising given the impact of the crisis related to COVID. So we see significant amount, almost a quarter flowing to Asia and the Pacific, and a much smaller percentage, 10% flowing to Africa, 12% to Europe, 8% to Latin America and the Caribbean, and a lot coming into the United States, into North America, looking at the US, Mexico, and Canada. And something that's notable is that usually when we look at overall giving internationally by U.S. foundations, about 25% flows to sub-Saharan Africa. And so in this case, we're seeing a much smaller percent flowing to Africa because the impacts have been very different there. And usually a much lower percent flows to Asia of overall giving by U.S. foundations, only about 18%. So we're definitely seeing an increase there. The other things I would say about where money is going and who it's coming from in response to COVID, we're seeing a significant growth in giving by companies and corporate foundations specifically. 14 of the largest 25 funders responding to COVID are corporates, are companies, or their corporate foundations. And we're also seeing in the top giving globally a lot of non-US actors rising to the top of that list, especially from China and India, like ByteDance, Tata Trust, Tencent, Alibaba. and others. And so the website on the page takes you to Candid's hub, where you can really get into the data about where philanthropy is flowing in response to the crisis globally.
Natalie, that pie chart is just kind of awe-inspiring, and you have to read it multiple times to make sure that you can see it's $1 billion that we're talking to as it relates to COVID, which is kind of unbelievable. So during our planning conversation, we discussed the two main legal options for U.S. funders to undertake global grant making. If that is, they want to fund a non-U.S. organization directly. So can you tell us more about what these are?
Absolutely. So if we go to the next slide, the two processes are called equivalency determination or expenditure responsibility. And so basically the rules are in the United States, if you are a US-based foundation and you want to make a grant to a recipient, that recipient is usually a US 501c3 organization, a charity here in the United States. If they are not a charity here in the United States, or they don't have 501c3 status, you can use one of these two processes to still make a grant. So an equivalency determination, or in the lingo of the field, we call that an ED. That process is really about determining whether the recipient in another country is actually equivalent to U.S. public charity. So you're going to be looking at the current requirements for 501c3 status in the U.S., collecting a lot of information from them, and then comparing it and seeing if you could make a good faith estimate that if they were in the U.S., they would be equivalent to a 501c3. And so that's a process that you do on the front end of making your grant, and then you proceed to make a grant and treat them as equivalent to a 501c3. A second option is to do expenditure responsibility. That's where, instead of really looking at the organization and making sure that they're equivalent to a 501c3, you are instead focused on tracking and reporting that the funds are used for charitable purposes. And so there are several main steps for that. The most important thing to remember is that instead of being an upfront process, there are pre-grant processes, but then the process continues for ongoing reporting on the charitable use of those funds. So it can go for quite a length of time. And there are some kind of pros and cons of both approach.
Can you unpack this a little bit, and like how does a funder choose between ED and ER, and what are some of those pros and cons?
Yeah, absolutely. So let's start with ED, the equivalency determination process. So one thing that's important if you've never done global grant making before is that you've likely never done an equivalency determination. It's a process used solely for global giving. And so it may be a new capacity that you need to learn and rely on outside expertise because your staff won't have done it before. Some organizations that you want to be equivalent just won't be. That could be because they're a government organization, or they're organized in a for-profit structure. It could be that they do a lot of lobbying and advocacy work as part of their mission, and so that doesn't really make them equivalent to a 401c3. Maybe they're more of what we would have as a 401c4. Or it could be that it's very difficult to get all of the information that you need to do the determination. They may not have some of the documents easily available. They may not be translated into English. It's a very complicated upfront process to determine equivalency. However, there are a lot of advantages to doing this. This process means that you do the work on the front end of the grant, and then you don't have to require grantee reports. They don't have to have a separate account just for charitable purposes. You can leverage ED repositories, which are where you can actually purchase an existing equivalency determination for your grantee partner, and then you don't have to go through the process yourself, and that's a real benefit to you in that it's quicker, it can be quite affordable, but it also is a benefit to the organization. They don't have to go through a process multiple times if you share a certificate that another funder has done for them. So for EDs, sometimes it works, and when it does, it means that you're really doing the work up front and then treating them like you would any other grantee. On the expenditure responsibility side, there are some advantages. this is a process that you might already use as a foundation. You can use it for some of your domestic philanthropy here in the United States if you're making grants to non-501c3 organizations. And the work up front, although you need to do a pre-grant inquiry, is much more limited. So on the other hand, some of the disadvantages are there's a challenge if it's for capital equipment or endowments, because you need to report on the use of the funds through their life of their value. And so for an endowment that continues to make grants over time or to fund an organization over time, you need to keep reporting and tracking that those funds are being used charitably. And similarly, if you're investing in a building, you'd want to make sure that it continues to be used for charitable purposes. The other big challenge for expenditure responsibility is that you can't really fund general operating support. And as we think about the best ways to invest in organizations, giving general operating support is a best practice and allowing them the flexibility to do their work. And so if you wanted to do a general operating support grant, you would need to use equivalency determination.
That's super helpful. So if a funder's never made global grants before this crisis, what resources would you suggest that they use in order to get started?
Yeah, it's a great question. So at the council, we are a membership network, membership organization, and one of our areas of expertise is helping U.S. foundations make global grants. And so if you happen to be a member of the council, there are resources you could access, but we also have a lot of resources on our website that are open to everyone. One of those resources is called Country Notes. And we'll make sure it's linked in some of the follow-up materials. And what it actually has is an overview of the charitable laws in that country that you can review to think about as you do an equivalency determination or to better understand how nonprofits are organized in that country. We also have a collection of reports and resources about philanthropy and civil society in that country that can be helpful. And we have 35 countries with those kind of detailed materials specific. So I think you want to start with really understanding the country you're giving in if you've never given in it before. And there are other resources with country-specific things you could access. So one of our partners is the International Center for Not-for-Profit Law. Their Civic Freedom Monitor is open and free and has a lot of in-depth resources about the country that you're working in. We also recommend, if you don't know a country very well, to leverage existing networks in that country who know it better and can help you. So we are a very active member of WINGS, which is a global philanthropy network of national philanthropy networks, if you will. And so there are over 100 philanthropy networks around the world that serve foundations in specific countries. And so you can go to the WINGS website, and if you want to make a grant in Kenya or in India or in Brazil, you can learn more about the philanthropy networks in that country who could be partners with you. Similarly, when it's really about connecting with those who know the country best, one way we suggest doing that is learning more about community foundations in that country who may have the closest relationship with the communities they represent. So there's the Global Fund for Community Foundations, and then there's also a Community Foundation Atlas, which both document more than the 800 community foundations located outside the US and Canada. They're all over the world and can be really powerful partners for your work in the countries where you're looking to invest your resources.
Natalie, those are awesome resources. Thank you so much. All right, I see that 3 questions have come in. Don't forget that Q&A box is there for you to use in case there's anything that caught your attention from what Natalie was asking, and we can dive into that toward the end of our conversation. Pilar, I'm going to turn the mic over to you. And I know that what you're going to reflect on is going to be really so well tied to where Valerie started and where Natalie took us. You know, Valerie talked about some of the lessons learned from the Ebola crisis. On the flip side, what are the lessons that we should have learned that it doesn't appear that we did? And what are we not doing in this pandemic that we should be doing?
Well, thank you, first of all, for the opportunity to share our thoughts and a little bit of the work we've done and what we've learned. So yeah, as Valerie reminded us of the Ebola crisis, you know, she talked about how this crisis, what we're living right now is definitely a more complex crisis, you know, impacting the entire world, as Ebola was more focused on just a few countries, which was still a very serious disease outbreak. And right now, I think that one of the things that we could have learned, a lot better has to do with preparedness in general. And I'm sure that many of you saw Bill Gates' video that's been around so much in the news from his TED Talk in 2015, when he talked about, there could be a pandemic and how we should prepare for it. So I think that preparedness is something that in general countries haven't done enough of. Focusing on improving the system's efficiencies and effectiveness, strengthening public health systems, having the right protocols in place, making sure that you have the right resources, building up on your PPE, strengthening the supply chain. All of that, I think, is something that, of course, it takes investment and it takes capacity. So in that sense, I believe that could, we still have a long way to go there in some countries. But all of that is not just up to, for example, funders to support that, but it has a lot to do with government ownership. Because in the end, we want governments at different levels, national, state, local, to own the process and to lead the efforts. As Valerie was saying also earlier, there's so much focus now placed on local actors in this response. And I also think that the other one has to do with community engagement. I think that in Ebola, we saw that one of the aspects or components of the overall response that could have gone a little better is the community engagement and the outreach. In a disease outbreak, and as in any emergency, but in this, particularly in disease outbreaks, it's so important to have the right messaging, the right education programs that take into account cultural aspects, the right language, the right, and not only language in terms of like the dialect, but the right messaging. And for that, it's important to work with the community and not just during the pandemic or the disease outbreak. That's why preparedness is so important. It's something that governments and local actors in general should be doing continuously. So I think when I look at what's happening now and reflect back on lessons learned from Ebola, I believe that these two aspects are the ones that that we're not doing so well. I think this has been a huge wake-up call, and countries are putting a lot more effort into this. And once we can say this has been, the COVID has maybe not, it's that it will be over as a pandemic, but that we can move forward. I think that definitely preparedness plans overall is something that will, as funders, will need to continue to support. Thank you.
Pilar, what are some of the challenges that NGOs themselves are facing globally that are important for our funders and our audience to consider?
So here I think that it's important to differentiate in terms of the challenges that an INGO, that an international NGO will face versus local NGOs. Valerie also mentioned the challenges that all of us are facing with, mobility. Our mobility has been restricted. We're not able to travel. And all of this kind of like new ways of working. Many of us have been somewhat used to working remotely, but when it's permanent, it changes a little bit, and it forces us to reflect. And NGOs, for the most part, having a headquarter in one place and then multiple country teams or country offices, they're used to that. However, in some cases, NGOs have had to ask, or out of safety or concern for their staff, they've asked their staff to return to their homes or to the headquarters office. So that's been challenging, because it actually may slow down the work of NGOs, and everything is just rapidly changing and evolving so quickly, that it's challenging for them. And I think that in that sense, NGOs that hadn't been working so closely with local partners and now see the need to do that, that it also presents a challenge. Can you do you have the time to build capacity in your local partners now, when you have the emergency and it's evolving so quickly, and need to operate? So I also want to point out that NGOs do face challenges. In the context of COVID, local NGOs, I think their main challenge is that they sometimes, and more often than not, get overlooked in terms of being organizations that can support response efforts, because, the large response efforts for COVID are led by and coordinated by the government institutions, and, with the guidance of WHO and the regional offices. So many times, even health-focused NGOs get questioned or overlooked, and many times it has to do because, as funders, we perceive that local organizations are more they're good for supporting or implementing development projects or very specific humanitarian emergencies. And we ask ourselves, or question ourselves, what can local organizations do? And that's where, where I think I go back to, these are the organizations that have the local networks, the culture and local knowledge. They can support that community engagement piece that I was mentioning in the previous question. And in some cases, NGOs have, the reach where sometimes there's very little government presence, and they can support activities such as, contact tracing, some operations or logistics, is to support quarantine centers, for example. Or they can be the ones who kind of like translate the government messaging for communities, especially in places, countries and communities where there's a low level of trust of government. And in that sense, NGOs have a higher level of trust from the community. So I think we need to take a closer look at that, and see how NGOs, the challenges that they face and how we can support them. Thank you.
Pilar, from a very practical angle, what are some first steps that funders can take to begin funding at a local level?
Well, this is interesting because when I joined the foundation in 2011, I actually joined a different team that was actually doing that. It was going from funding work in the U.S. And had just moved towards doing global work. And I think that it's important to first define the area. Look at your strategy and define your focus area of your strategy, and where you want to do that work. So once you have that, you can do a little bit of research. It'll take some desk research, most likely, to find out about who are the local actors, who are the key stakeholders on the ground. What are the existing capacities? What are the existing skills, expertise? And in that sense, it's important to try to also identify what the gaps are. It's kind of like doing a landscape analysis, and based on your team's strategy, on the strategy you have, on the geographic area you want to reach. So identifying existing capacity and skills, and the gaps that are there. And I want to say that one of the activities that we did in our team, and I do that even today, is try to listen to different voices on the ground. So if you're moving into global, you will most likely decide, to focus, for example, on a specific country or region, and because especially at the foundations, we want to impact at a systems level. We want to make sure that we are different. We're listening to different voices, and not just, of course, you have to work with the government in many cases, because governments are such an important part of sustaining projects and programs. But you also want to involve the private sector, if they're a key actor, and civil society, local voices. That's definitely something that's important. Academia, or even the media, if they're also an important stakeholder and actor. But most importantly, I think you have to realize that going global takes time, because it takes time to build relationships and to gain trust, and to identify who those champions are in the context where you want to work. Yeah,
Pilar, I'm going to jump in because you've set us up so perfectly to segue to our next section, which is really talking about localization. So all of us, the Center for Disaster Philanthropy, the Bill and Melinda Gates Foundation, and the Council on Foundations, we've all been involved in conversations and activities looking at localization and moving power to people closest to the disaster impacted area. Defining, I'm making fun of myself because I know that defining localization could be its own webinar in and of itself, but here's a few highlights that will contextualize the topic. Traditional aid and development interventions in international contexts are often critiqued for being focused on the goals and practices of the funder rather than driven by the needs, desires, and resources of the aid recipients and local service providers. And in the localization model, the focus becomes centered on local decision-making, where power is in the hands of those most affected by the issues. And while external funding, support, and technical assistance are still important and required, the power dynamics shift through the localization process. And those on the ground, the local actors, are then charged with program planning and management, allowing them to use their local knowledge, history, and connections to develop services that are compatible with the cultural, socio-political, and economic climates of the communities that they serve. Through CDP's partnership with the Bill and Melinda Gates Foundation, it led to the creation of a new section in our Disaster Philanthropy Playbook that's called Strengthening the Local Humanitarian Leadership Philanthropic Toolkit. And when you all look at this, you'll be able to hyperlink to the actual toolkit itself. It's designed really to provide information about the concept of localization and the way in which a group of 14 US-based funders are addressing philanthropy's role in strengthening local humanitarian leadership. I want to ask each of you now what activities you're working on that are connected to the concept of localization and why it's important. Natalie, if we could start with you and then go to Valerie and Pilar, that would be terrific.
Yeah, so I can talk a little bit about what we're doing at the Council on Foundations. I would really bucket our work into 3 main areas, and they align really with the things we do as a network. So one, I think there are regulations, and that can cause challenges or discourage direct giving internationally. And so we historically have helped work with US-based foundations and then serve as a bridge to the Treasury and IRS, and as well as Capitol Hill, if relevant, to think about how we can improve the regulations of global giving to encourage direct giving to local organizations. And so a good example of that was our work throughout the early 2000s to make it possible to have equivalency determination repositories that actually can share an ED between different funders, making it easier for US funders and faster to do global giving, but importantly, also making it easier for recipients to not have to do that process with many US funders. We also do a lot of work around building capacity of US foundations to give globally directly to nonprofits overseas. I would also say that we in our network have a number of intermediary grant makers who may be a better option for US funders who want to give to local organizations, but know that they don't have the capacity, the relationships to find who those actors might be on the ground. And so there's a number of intermediary actors like CDP and their work, others like Global Giving, like CAF America. There's a whole list of them that you can use as a partner to help get your grants into the hands of local partners on the ground, people with deep expertise and who those actors might be, who could help serve as connectors for you. And that really is the third area. For us, it's a lot about relationships. You heard that in Pilar. It's not easy to just start making grants internationally. And so how can we help US foundations build relationships with networks and partners overseas to do this work in the right way? It's not simple and straightforward, but it can be really rewarding to have a more localized approach to your giving.
Thanks for that, Natalie. Valerie or Pilar?
Yes, thank you. I think one of the things, and Pilar alluded a little bit about the preparedness, about the system. We know that when disaster happens, the first responder are local, national, and that is where we start really, although we're still working with the international organization, we decide to actually get a whole work stream to work on the capacity strengthening and to the local organization. And for that, we actually looking at different work stream or different piece body of work. One is to look at like the government, and the other one the local NGOs, the academy, and all the different networks. But the more important is that we have to learn ourselves as an organization, as a foundation, to what does that mean to really go local, because it requires a different way of operating. It requires patience and it takes time. And Pilar said it requires trust, because some of these organizations of government are not being used to have somebody ask them, what do you think is a problem and what do you need? They usually surprise. Even government is like, nobody asks us what we think. They usually tell us what we should do. And even for you, sometimes when you discuss with them, you try to, you ask them and they say what, and they ask you the same question, and you're like, you have to refrain yourself by giving your idea, because your idea, no matter how much, they'll take your idea to make it like it was them, but it's not really them. That is the first thing. It's like, how do we actually move there? It requires different grant making, as Natalie mentioned. You not do the 501(c), you have to look at equivalent affidavit, and a lot of them don't have it. And that means that it's expenditure responsibility, it takes time, but the reward is so big when you start having them turning, because we saw that now after many years of working in that, some of these organizations upgraded, but also the power and the change of the dynamic, or how they can come with idea. And again, I come back to the innovation I mentioned earlier. The innovation piece is that they'll come with idea that you never have thought about it from where you sit, and it will be just so powerful that you're like, wow, this is amazing. They have that capacity, but it requires us to learn. But I probably go for Pilar to go a bit deeper in one or two examples if you want, Pilar.
That'd be great. Pilar, do you want to dive in?
Sure. Yeah, I was, just as Valerie was saying that, I was just thinking, for example, specific examples. So we support a network of 4 countries in Central America. the C4, so Honduras, Guatemala, El Salvador, and Nicaragua. And, they're constantly, they're a very vulnerable region. So instead of funding individual local organizations, we fund a network of networks. And we started by funding an INGO that was working with them because they just didn't have the capacity to manage the funds. They needed some organizational support. And through the years, this has been, quite a few years now, they have developed their own capacity that we don't fund through an intermediary anymore. We fund them directly, and we've seen the maturity of the network and the power of the collective. Not only, are they an organization that they're there to implement projects, but what they do is that they represent and they give voice to the local organizations of their countries in different global platforms and regional platforms. So that's something important where we've seen funding from an intermediary and now directly to the organization. And I wanted to add something that we do with, we fund the NEAR network. And the NEAR network is, it's a network of empowered aid response. And it's a global South organization. And more than anything, what they do is that they advocate for localization. They are present in, different spaces of conversation, of discussion, dialogue, and they are working on how do we hold accountable those who said that they were going to support localization, especially that commitment to fund local organizations. So that's something that those are two important examples that we're doing. And Regine, what you mentioned about the work that we've been doing as US funders, I think it's important to learn from our own peers. What are we doing? What can we do collectively to move not only our own knowledge forward, but is there anything that we can fund collectively, for example? And I think, with the support of CDP, the partnership that we've had with CDP and other important US-based funders, the learning has been incredible. And I think that if anybody else wants to join that discussion group, yes, please reach out to us. Thank you.
Absolutely. All right, we're almost at the top of the hour, but I think that if we stay super tight, we should be able to get 2 audience questions answered. Okay, so if you guys can take 30 seconds to answer these questions, that would be excellent. First question, let's put this to Valerie. What would you say are some oh my goodness, my list is getting the best of me. What would you say are some successful and effective projects and practices that were developed during Ebola, which should be funded by grant-making organizations to replicate, adapt, and use in other countries during COVID-19?
Thank you, Regine. I think the 2 or 3 things that I'll say is the support that actually look at the health, but also the non-health, helping people to recover. That means that if the woman, how do you get economic back? How do you get the schooling back? How do you get teachers back? I think that is one. The second I'll mention is that anything that help build back better. That means that even if you look something that work with the COVID now, how do you create a way to build on that system so that it's something after the crisis is left beyond? But also more importantly is you really have to look at how that project or whatever you support, especially I know a lot of people want to do PPEs, want to do health recovery or health support. It's important, again, like we said, to make sure that it's linked to your, as Pilar mentioned, it links to what you are good about. Don't go and try things that you don't know about. And if you already have project, how do you leverage existing resources, existing project already to actually complement the support you're already doing? Thank you. And more important
Thank
thing,
you.
maybe the last piece is that how do you support the organization? Because there's a lot of challenge that the organization face, as Pilar mentioned. For example, a lot of these organizations virtually don't even have internet, or the internet is so weak that they can't even have a communication with you. How do we even support them with some of these basic insurance, communication, internet, phone bills now to make sure that this is covered in the support you do to them? Thank you.
Thank you. Natalie, last question is going to go to you. What resources can you recommend for training or capacity building around ED? Are there organizations that a foundation can hire to do this?
Yeah, it's a great question from Lindsay. So the number one organization I would start with would be what's called NGO Source. Their entire business is doing EDs. They are a ED repository, and they have a guide which will include in the resources a guide to equivalency determination, which really walks you through the process. You can use them as your partner, or you can leverage their resources to build your own capacity. That said, there are lots of other intermediary groups that can also help with that capacity building, so we'll include links to those in the resources. But there's a lot of information out there to either do it yourself, or there are several sets of partners you can use instead.
That's awesome, Natalie. Thank you so much. Well, as we begin to wrap up, I'd like to summarize some of the discussion and provide the audience with some key takeaways from our conversation. Local actors really need to be the leaders. It's important to shift the power and focus on putting power and control in the hands of local organizations. Start small and grow your investments. International funding is not at all as daunting as it might seem. Use the available resources and partnerships that exist. There's a lot of support available to help funders who want to fund internationally. Natalie, Pilar, and Valerie have all highlighted at least one. Definitely call, email, or check out the websites that were referenced. We need to get out of emergency mode. We should be responding to the pandemic, but also supporting preparedness and long-term recovery. And as our panelists have shared, there will be ongoing needs to assist with recovery efforts over an uncertain length of time. CDP and its partners at Candid are tracking philanthropic donations to the pandemic. And as of June 18th, the total donations received stood at more than 11.7 billion, again, billion with a B, dollars. CDP itself has many resources devoted to disaster philanthropy that can assist you, including our COVID-19 response fund. And our staff are always available to provide guidance. You can find more information about our work at disasterphilanthropy.org. To those of you who may be planning disaster response funding, we have additional information on our disaster philanthropy playbook, including the localization toolkit we talked about earlier. You can find this resource at disasterplaybook.org. Our next and final webinar in our COVID-19 series is on July 14th. That's 3 weeks from now. And the topic will be COVID-19 support for mental health, bereavement, and grief. Our speakers will include Woo Hong Deep, a consulting psychologist at the Headington Institute, Lisa First, the Vice President for Policy, Advocacy, and Education at Vibrant, and Heather Nestle, the President of the New York Life Foundation. In order to respect everyone's time and keep this to an hour, unfortunately, this is all the time we've got for today's webinar. Thank you so much to Valerie, Pilar, and Natalie for taking your all's time to share your insights. And special thanks again to the UPS Foundation for supporting this webinar, and to our co-sponsors, Interaction, National Voluntary Organizations Active in Disasters, the Council on Foundations, the National Center for Family Philanthropy, Grantmakers in Health, Grantmakers in Aging, United Philanthropy Forum, and the Funders Network for Smart Growth and Livable Communities. And thanks to you who all joined us. As the webinar ends, a brief survey is going to pop up, and we'd love it if you just would take a quick moment to share your thoughts. If you do have questions that were not addressed during today's webinar, you can certainly email them to me at regine.webster@disasterphilanthropy.org. Thank you all so much. Stay healthy and have a wonderful afternoon.